How close? And what do we need? You. Ladies and gentlemen, President Tanaka, past President Louis, it's a huge honor to have the opportunity to give an opening address here at such an important peace forum. Because this forum lets me talk about the issue closest to my heart. And it is not, believe it or not, polio eradication. It is about what we are achieving through polio eradication. And what we are achieving, what Rotary is achieving, is a better world and the foundation for a more peaceful world. When Louis sent me the invitation to speak here, he told me, you cannot give an update on polio. And I thought, thank goodness, I do that all the time. He said, I want you to talk about what it is doing for the bigger goals of Rotary in building a better world, a world more peaceful. And indeed, that is the reason I get out of bed every morning to eradicate polio, to work for Rotary. It's because of what we are doing through the Polio Eradication Initiative. So I'd like to use the next 20 minutes to tell you how the work you are doing through your flagship program underpins so much of what you want to do and achieve in Peace Through Service. I want to start with this picture. This little boy was 3 years old when he was paralyzed on the 23rd of August, 1991 in Peru. He became famous for that on that day because he was the last child ever to be paralyzed by polio in the Americas, proving that this disease could be eradicated and that Rotary's dream of a polio-free world could be achieved. But many people don't know Louis' story. Louis was paralyzed by polio because he wasn't vaccinated. And Louis wasn't vaccinated because the local health center had been destroyed in the fighting and in the conflict that affected that part of Peru at that time. And that is the reason that Louis was paralyzed. That was the reason so many children are paralyzed, and the reason for so much of the under 5 mortality around the world. Because unfortunately, Louis' story is not a rare one. Over 1.5 billion people today live in countries that are affected by conflict, where conflict has affected their lives, their access to health facilities, and their access to a better future for their children. So when Rotary set out to eradicate polio over 20 years ago, you were setting out to tackle some of the most fundamental issues that underpin conflict. Issues related to equity, issues related to social justice, issues related to equal access for the most basic of human services. Because to eradicate a disease, as Dr. Bill Fahey of the Centers for Disease Control once pointed out, is to pursue the ultimate in social justice and equity. Because you cannot eradicate polio without pursuing the goals that you have in Peace Through Service. To eradicate polio, you must reach every community everywhere. You must get countries that don't talk to each other to coordinate and cooperate. You must get communities that are cut off by conflict. You must develop safe passage so they can be vaccinated. And indeed, the polio eradication program brings together national and international cooperation, the promotion of peace to allow the vaccination of children, and, where necessary, the resolution of conflict to be able to ensure children are vaccinated, and that we open the door for dialogue, for discussion, and ultimately peace. This has happened again and again through the Eradication Initiative that you launched, and you have used it as a platform for peace in many, many areas. Through the Eradication Program, Rotary has spoken to presidents, to political leaders, and to local leaders around the world to cooperate within their countries and across their country. Rotary has spoken to traditional leaders and brought traditional leaders and other leaders together who otherwise would not cooperate, would not understand each other's agendas. Through the polio program, Rotary has brought together religious leaders from different factions, different groups, to overcome misunderstandings and ensure that children could be vaccinated. But through Polio Plus, through vaccination, Rotary has brought more understanding, more cooperation, more international collaboration than we've ever seen in history. 10 years ago, in The Lancet, the leading medical journal in the world, two authors in an editorial wrote that Rotary has created the largest internationally coordinated health initiative in history, and in doing so, brought a level of international coordination, understanding, and cooperation that we had never before seen. When you set out to eradicate polio, however, it looked much, much bleaker. This was the world in terms of polio-infected countries, all the countries that you see here in red. Many of these countries, as you know, were either suffering conflict at that time or became affected by conflict over the subsequent 20 years. Many people despaired in the face of conflict, despair in the face of trying to resolve these conflicts and the difficulty of the problems they encounter along the way. But Rotary has never flinched. And despite the size of the problem you faced in 1988, despite the conflicts you encountered along the way, you have brought the world to this picture today, a world very, very close to being polio-free. Ladies and gentlemen, going from the last picture you saw to this picture is more evidence than anyone will ever have that Rotarians deliver peace through service. Now, as we look at the eradication initiative, we can draw some very strong lessons as to some of the things that work when we are pursuing peace and pursuing a better society in such environments. One of the most famous things that the polio eradication initiative has given birth to has been this concept of days of tranquility, when we negotiate across warring factions to lay down their arms for at least a limited period so that children can be vaccinated. This initiative, this term, grew out of the early days of the eradication initiative, when as early as in the late 1980s and early 1990s in El Salvador, the warriors put down their weapons for a few days such that children could get vaccinated. Many believe that this is what led to the road to peace in that country. This has been the story over and over again in many polio-affected and conflict-affected countries around the world. A more recent example is from Sierra Leone, where in the late 1990s and early 2000s, for the first time ever, warring factions sat in the same room to discuss a common agenda. It wasn't to discuss the peace terms, it wasn't to discuss division of the country. Rotary brought them together to discuss polio eradication and the vaccination of children. And many people believe that that was what started Sierra Leone finally down the road to the peace that it knows finally today. But the days of tranquility are only one of the many strategies that have been used to cooperate across countries, across minds, across warring factions, and to bring some modicum of peace to areas which had long been ravaged by war. But in fact, there's been many other strategies, many other lessons that we've learned along the way in the polio program. The first thing that Rotary taught us, the World Health Organization and the United Nations, was about local negotiation and what we could achieve in terms of building peace by negotiating for something as simple as access for vaccination. This is a picture from Côte d'Ivoire in 2005. The country was still infected by polio, but the North and the South at that time were divided, as many of you know, by conflict. And it was Rotary which challenged us, the World Health Organization, to join them in going to the president and say, we would like to negotiate with the North for access so that children can be vaccinated. The government said, here's a helicopter, we hope you don't get shot down, good luck. And we were foolish enough to board the helicopter with Rotary, but the rest is history. The whole country participated in a joint vaccination effort. A country exhausted by conflict stopped for a few days to remember that to have a better future for their children, they would have to cooperate. They would have to provide the most basic of health services. Just a year ago, Ban Ki-moon, as he launched the emergency plan to help finish polio eradication, he saw the tight linkage to his agenda for peace and global understanding. And he announced that I will continue to call for days of tranquility in all areas where conflict is preventing access to children during polio eradication drives. Because remember, to eradicate polio, we have to reach every child everywhere. We can't wait for conflicts to stop. We can't wait for peace to be built. We have to stop the conflicts. We have to build the peace. And it's been Rotary which has said persistently, consistently, yes, 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 you can, and have challenged us to do so. You have kept pushing us over 20 years to reach every child, to find solutions, and often been out there in front of us doing it. An eradication program is a fantastic opportunity to be able to build peace, because you have to reach every child. Carol Bellamy, the ex-executive director of UNICEF, once said, after I explained the eradication program to her in the early days, she said, we can't wait 20 years for conflicts to stop. We have to vaccinate children now to stop polio, but more importantly, if we are going to build the future generations that are going to be able to build a recovery in these post-conflict situations. The other thing that we've learned through the eradication program and through Rotary when it comes to conflict resolution, when it comes to building peace, is the importance of innovation. Every situation is different, and we have got to be innovative as we try to stop conflicts, to reach children, and to vaccinate, but also to build peace in doing so. I put on this slide just a few of the many strategies we use when people ask me, how do we operate in Somalia? How do we operate in South Sudan? How do we operate in southern Afghanistan? How do we vaccinate in eastern Congo? How do we do surveillance in the FAT areas of Pakistan? We use a whole variety of strategies. Local access negotiation through the International Committee of the Red Cross is a key strategy in in Kandahar, where I've just come back from on Wednesday. We use permanent polio teams in southern Afghanistan to try and get out to communities on a regular basis, not just during polio campaigns, and with more than just polio. We use something called remote programming, so we can work through local communities when we aren't allowed in there due to our own security problems. We have special strategies, and most importantly, we try to deliver other benefits to demonstrate, again, the value of stopping these conflicts for at least a limited time and giving peace a chance. This again brings me back to Rotary and the innovativeness of Rotary when it comes to building peace. This is the border point, the Torkham cross-border point between Pakistan and Afghanistan. And you can see here that they put up a cross-border polio vaccination point to make sure that they cooperate on both sides of the war-ravaged area to get kids vaccinated. Again, it's a vehicle to a much, much bigger agenda. Everybody now is familiar with this picture. Everybody in the world is familiar with this vaccination point and the stories behind it. Very few people are aware that Rotary International built that border crossing point and ensures that children get vaccinated. And this very simple innovation, in the name of vaccinating children, helps to slow down the conflict, ensure children get vaccinated. The other things we've learned are the value of partnerships and the value of some novel and unique partnerships. We have learned through the work to reach children for polio eradication that everybody will cooperate, everybody understands the value of children, the importance of children, and the importance of ensuring that they have at least some degree of protection against things such as polio, other infectious diseases. In the Democratic Republic of the Congo, where we had days of tranquility, the United Nations suspended all of their operations, their broader operations, to carry our kick polio out of Africa vaccine carriers into the usual conflict-affected areas to ensure children could get vaccinated. And over the years, we built partnerships with some of the most incredible humanitarian organizations around the world, such as the International Committee of the Red Cross, Médecins Sans Frontières. We've also built partnerships, and Rotary has built strong partnerships with political bodies like the Organization of Islamic Cooperation, which is so important to much of the conflict that's going on today and its resolution, its dialogue. We've also learned to work, when necessary, with the military presences in these places to ensure that they will also ensure safe passage into areas usually affected by conflict. So through this program, we have learned to innovate, we've learned how to operate through new partnerships, and we've learned how to negotiate. You, through pushing the polio eradication agenda, a very specific agenda to eradicate one disease, have actually built a foundation and a knowledge base for stopping conflicts, for building understanding, improving cooperation in some of the most complex and complicated conflicts in the world. The other thing that you've taught us is how to engage all parties in the improvement of the futures of their children. I love to show this picture here from Afghanistan. This is a Taliban tank, actually, from about 10 years ago. But you can see very make out the paper on the tank and across the front. These are all emblazoned with polio eradication posters. And you can see the chap with the microphone is actually telling all the parents to come out, bring their kids, get them vaccinated against polio. We have learned to engage them first in polio eradication, then in the dialogue about the health of their children, the importance of routine immunization, bed nets, other things. But polio has proven to be an entry point into some of the most complex communities we've ever had to work with. In Somalia, we have learned to work with all the various warlords in that war-scarred country to ensure that polio vaccines can get to children, to ensure that we can develop routes of safe passage to get not just vaccines, but other interventions into children in these areas. And you can see here, we finally got to the point in our negotiations, not just that we would have safe passage, but that we would be escorted, the vaccination teams would get full protection. That wasn't quite our goal, actually, but this is where we ended up in terms of the engagement. So I read, actually, and I read just last night in preparing to give this talk, a wonderful book called The Shackled Continent. And it's a book written by one of the editors of The Economist, who was a longtime African correspondent. And he talked about his time in Somalia and working in Somalia. And he talked about a horrible experience he had one time when he was right at the dividing line between areas that were controlled by two different groups of warlords. And he said he was standing there at this checkpoint when a truck came along, and the truck was full of women and children. And they stopped the truck, the warlords from this other group. They made all of them get off of the truck, and then they lined all the children up against the wall. And he said it was one of the most horrific things he'd ever seen in his life, the disaster that he thought we would see unfold in front of him. But then what he saw was the warlords say, okay, to the children, open your mouths. And they took the dropper with the vaccine and they went right along the line and vaccinated all the children. And so in his book, where he recounts the story, he says what Rotary International is doing, what they are helping the World Health Organization to do, and UNICEF to do, is foreign aid at its most heroic, at its most important, getting to the communities that need it the most, and building a way to reach people to build peace. And it was for this reason, however, that I wanted to show you a couple of the following slides, which aren't the prettiest ones in this presentation, but I want to remind you of the cost of this heroism. This is a Jeep from our program in Afghanistan, in which 2 of my staff were killed 5 years ago when they were setting out to vaccinate children. It is a dangerous environment in which we operate. Building peace is a dangerous business, even if you're doing it for something as simple as eradicating polio. This, unfortunately, is a picture from just a few weeks ago, well, a few months ago now, on the 19th of July, when I lost another one of my staff in Pakistan. This is Muhammad Ishaq, who was shot dead because he was vaccinating children and trying to protect them against a disease like polio. We are building understanding, we are building cooperation, but we still have a very long way to go. And with these couple of slides, I just want to remind you that as we do so, it is a dangerous business that we're engaged in still. And we're hugely grateful in that business that we have a partner like Rotary International who is so committed to such basic principles as building peace, because that ultimately is what this program is all about. And that's the reason, as I come to my closing, I wanted to show this picture to you, because I'm not sure everybody is aware in Rotary of this article that was published in the Wall Street Journal in 2005. And you'll see the title. It says, Polio and Rotary. Now the text you can't read, but I want to blow up for you one part of it, because this is what the world thinks of Rotary's contribution to polio eradication, and through it to a more peaceful world, a world of better understanding, better cooperation, and better collaboration. When people like the Wall Street Journal look at the polio eradication program, and they don't say it's great you eradicated polio, they say Rotary's polio effort deserves the Nobel Peace Prize. It means they understand what you are really seeking to achieve through your work, through your service. Whether you ever get the Nobel Peace Prize, I certainly believe you deserve it. Ladies and gentlemen, there's one little point about Nobel Peace Prizes that you should know. You don't get it unless you complete what you set out to do. You don't get Nobel Peace Prizes for a great idea. You get them because your idea was right and it's proven. And ladies and gentlemen, this map is polio today. You are very, very close. As you can see, we're in the high season for polio right now, and we are finding the virus in only small parts of 3 countries. We got this far because of Rotary's commitment that every child mattered, every community mattered, and that this initiative mattered, because not only would it build a polio-free world, it would build global cooperation on a scale never before seen. It would build global understanding and force understanding, communication, and dialogue, and at the same time deliver such a gift to future generations. But ladies and gentlemen, we're not quite there, as you can see, and what we need, if we're going to secure that long-lasting legacy of Rotary's contribution to a more peaceful world, we have to finish this job. Otherwise, you don't get the Nobel Peace Prize either. Now, the other thing I like to remind Rotarians, because often I get asked about why are we just eradicating polio? And you're not just eradicating polio. You're building peace, and we've talked about that. But more importantly, you're building better health systems, better access to these children. And remember, as we leave, the world's highest child mortality rates. Most children that die in the world die in the 15 countries or so that have been affected by conflicts in the last 20 years. So your work in these countries to eradicate polio has forced these countries to find solutions to getting to children, to stopping conflicts, to rebuilding those healthcare facilities that were destroyed, such as that one of Louis Tenorio so many years ago in Peru. But your effort to end polio now will build peace, will build better systems, and will allow for healthier generations in the future. So ladies and gentlemen, as we say goodbye to polio eventually, and as the world says, thanks Rotary, they will be thanking you not just for a polio-free world, but for a world in which you have once again, through your ceaseless endeavors, laid the foundations for a more peaceful world, a world with better understanding, a world with better cooperation, but in the worst case scenario, a world also where you have proven conflicts can be stopped, to reach children, to vaccinate children, and make a better future for future generations. Ladies and gentlemen, it is an absolute honor to work with your organization. It's been a great honor, President Tanaka, to speak this evening. I'm hugely grateful for it. You are making history with polio eradication. You are also making peace. For that, we thank you.